Hello, and thank you for joining us today. My name is Emily Porchak, and I'm the Community Engagement Project Coordinator with the Oxford Ontario Health Team. Today, we will be reflecting on the impact of the Oxford OHT during the 2025-2026 fiscal year. Earlier this month, we released our year in review report, and today we'll be going through that in a webinar format. Please feel free to use the chat or the Q&A throughout the session to ask questions. Heather Dedman, the executive assistant, will be helping to monitor the chat. Please note that this session is being recorded and will be posted publicly on our YouTube channel afterwards. And that is why we have disabled your camera and audio. And we will not include the Q&A portion in the recording. So please feel free to ask any questions or chat as we go through this session. Today's session will begin with a high-level snapshot of our impact this year before diving into several key areas of work. But before we begin, I personally think we should take some time to recognize the importance of this land where we live and work. With the intention of learning and unlearning, we are reaffirming our commitment to and responsibility toward Indigenous peoples and their diverse, all-encompassing cultures. It is important to think about the past wrongs and mistakes, to acknowledge them, and to consider how we as a group and as individuals might continue to work towards justice, unlearning, and reconciliation. I think it's really important for us to recognize that reconciliation is relevant here in Oxford County. Sometimes I hear that people assume that this work only applies where there are reserves and Indigenous organizations, but Indigenous peoples live throughout our communities and seek healthcare here. Our healthcare system continues to be shaped by historical and ongoing inequities, and it is our job to prevent that. I commit to continue to working towards those calls to actions in my role. And now we'll start with a kind of snapshot overview of our work. When we think about this past year, what stands out is that our work focused on creating impact and change for those living and working in Oxford. More people in our community now have a connection to primary care. This is an ongoing relationship that supports health over time. Providers are using digital tools and building skills through palliative coaching and education, which creates more meaningful conversations with patients. We are bringing mental health and addiction supports closer to home, shaped directly by what our community told us that they needed most. It is important to know that these aren't standalone projects. Many of the changes we will discuss today started with community members, patients, providers, maybe some of you who even joined this call today, working together to close these gaps. As an OHT, we support making the conditions possible for solutions to come to life. And we know that access to primary care, which is a family doctor, nurse practitioner, and allied health workers, continues to be one of the most important issues that we hear about. This year, a major focus was strengthening the Oxford primary care network and creating stronger connections among providers. We had 172 providers receiving regular updates through our newsletter. 24 providers participated in discussions about how primary care should evolve locally, with 10 providers joining a dedicated group to guide primary care planning moving forward. Beyond these numbers, we supported the approval of a teaching clinic to help attract and retain physicians in Oxford, advocacy to improve opportunities for international medical graduates, and collaborative funding applications to address local care needs. One example of what collaboration can achieve is the Tilsonburg Unattached Care Clinic. This clinic is operated by the Ingersoll Nurse Practitioner-led clinic and provides care for people who do not currently have a family doctor or nurse practitioner in Oxford. More than 1,900 appointments were provided to 657 people in our last fiscal year. For many people, this created an alternative to relying on emergency departments for non-emergency concerns, which our patient stories here demonstrate. One patient shared, "I have been waiting for a doctor for 5 years, and this is the first time I've been able to seek medical care outside of the emergency room since then." Community engagement is also at the heart of how the OHT operates. Throughout the year, we hosted 31 engagement events. These are booths and presentations out in the community that reached more than 1,500 community members, and we also distributed over 1,500 resources. Our most popular resource is a postcard with information about services you can access if you don't have a primary care provider. Our community council plays a critical role in this work, and it includes community members with lived experience who act as voting members within our governance structure. They help identify priorities, gather community feedback, review plans, and ensure community members help to shape a health system that reflects the needs of our community. One exciting milestone this year was welcoming a new community council member, and we're hoping to recruit up to 3 more this year. We would love to hear from you if you or someone you know might be interested in becoming a community advisor. The community advisors saw a great need for a single, easy to use, large print resource for older adults and their families to support them with aging well in Oxford. So they came together, developed a resource, and it launched in October. And between October and March, it was viewed over 400 times on our website, and we distributed 350 print copies. The resource brings together information on services and supports to help people age well. And one of the main goals is just to get people thinking about their wishes earlier and having those conversations with their loved ones before they are in crisis. One participant shared, "I didn't realize that there were so many supports for aging available here. It is really important that people know this, and I'm glad that people like you are telling us." We also have highlighted a couple of other ways that we engage with people through our social media and newsletters and website, and that helps us to get information out. We conduct feedback surveys and co-design sessions to involve people in our work. And our goal is really to work at all levels of the engagement continuum that you can see at the bottom of your screen as needed, so that we go from informing people about services to involving and collaborating them, and sometimes even empowering community members to develop tools and resources of their own, like the Aging Well resource on this slide. The Heart Hub is a homelessness, addiction, and recovery treatment hub. And we launched that this last year. And we knew that before services were launched, we needed to understand what people in the community wanted and needed. We involved the community in many ways. We hosted 4 Harwood community conversations in partnership with United Way Oxford to better understand community needs, and that led to the development of 9 community stories that were used at 7 co-design roadshow sessions across Oxford County, where we spoke with 80 participants to better understand client journeys. We then did 11 oral surveys by partnering with the Mental Health Outreach Bus to hear directly from people living in encampments. We still have community advisors as part of working groups that are working with providers as we continue to build out the Heart Hub. What we really heard from the community was the importance of meeting their basic needs: stable housing, free mental health and addiction supports that are available in our community, caring and compassionate staff that aren't burnt out. They need help navigating the system, having spaces that are emotionally safe for them, and supports for family members and opportunities to continue to build skills. I was fortunate enough to lead this work with Malaysia, a student with the OHT at the time, and we got to present at the International Conference on Integrated Care in Birmingham, England this year to share how community voices help shape system design. This engagement directly influenced service planning and implementation. I'd like to start by clarifying that the Heart Hub is not a single building, but it's a coordinated network of care, bringing together health, housing, and social supports to create clear, connected pathways to recovery and stability. It is a collaborative initiative of the OHT led operationally by Woodstock Hospital, the Oxford County Community Health Center, CMHA Thames Valley, and Oxford County also receive funding to provide core programming and services along with the remaining 16 partners. Individuals 18 and older can contact the 24/7 phone line to work with staff on a personal care plan to meet their goals. This could include withdrawal management, 90-day bedded supportive treatment and recovery beds that operate out of the temporary wellness center while a permanent location is developed, community group therapy, mobile outreach and supports, including primary care and transitional housing. This was intentionally designed to reduce the need for people to repeatedly tell their story and get people connected to recovery and stability. The Heart Hub's Wellness Center became operational on December 3rd, 2025, and we are able to share a couple of testimonials that demonstrate the early impacts it's made in our community. One person shared, "I think my overall attitude towards drinking and partying has changed. I quit on my own a couple of times, but I always went back to it. Here, I feel like I have received the knowledge and tools I needed." And another shared, "I have a clear mind. When I got here, my brain was foggy. I got my life back together, and now I want to go back to school." We are continuing to learn lessons along the way and will adjust the Heart Hub programs and processes as we grow. Health equity is a lens that applies across to all of the OHT work. The Health Equity Community of Practice brought organizations together to learn from one another and identify opportunities to improve accessibility, inclusion, and equity. Highlights included Indigenous cultural learning opportunities, hosting a blanket exercise where we learned about colonization and the lasting impacts in a health system, a health equity framework workshop with Southwestern Public Health so that organizations have common language and tools, and we launched the OHT land acknowledgement this year as well. The Oxford Ontario Health Team's palliative care clinical coach, Diane Murray, supports organizations in Oxford to integrate a palliative approach to care earlier in a person's journey. This year, 450 providers received coaching, mentoring, or education, as well as 350 community members received information through presentations. This work is helping to build confidence, improve planning conversations, and better prepare individuals and families facing serious illness. Her work helps to show that palliative care is not just end of life care, but an approach that belongs to all stages of the health journey. Digital tools can also help people become more active participants in their care. One of those tools is Connect My Health, which gives people free access to hospital records from participating hospitals across southwestern Ontario online. We helped get 995 new residents registered this year, with about 45% of registrations coming from word of mouth. We also did a pilot with 27 primary care providers who participated in an artificial intelligence or AI scribe pilot. This technology generates clinical reports during appointments to help reduce administrative burden. About 3 hours per week were saved on documentation, and this reduced after hours time and increased time to focus on patient care. 83% of providers felt it had a positive impact on their workflow. One shared that AI Scribe has been a huge time saver. It helps me recall important details of the interaction and have timely completion of admin tasks such as charting. Now, none of these outcomes that we've discussed today could be achieved by a single organization working alone. The Oxford Ontario Health Team brings together healthcare, community, social service, municipal, and lived experience partners who share a commitment to work better together to create a stronger, healthier community for all. This collaboration is what allows us to address many of these challenges that I've talked about today. Now, as we look ahead to 2026 and 2027, our priorities include expanding primary care attachment efforts, including supporting over 11,000 people to get attached to a primary care provider. We encourage people to get on a list for a provider through Healthcare Connect. We'll be expanding the palliative care pathways into hospital settings and supporting chronic diseases like COPD, which is chronic obstructive pulmonary disease. We'll continue to contribute to digital health integration and further develop mental health and addictions services. We are supporting an Aging Well roadshow across all of Oxford. And really, we're trying to strengthen a coordinated and patient-centered regional system. We know that there is still significant work ahead, but we are excited about the momentum being built through our partnerships and community involvement. And now I'll just take a moment to pause to see if there are any questions in the chat that I can address. We would love to stay connected with you. You can find us on Facebook, LinkedIn, and YouTube. We have lots of information on our website as well. And just a reminder that a recording of this session will be posted on our YouTube channel. If you have any questions that come to mind after this session today or any great ideas you want to share with us, please reach out at info@oxfordoht.ca. Thank you again for joining and have a great rest of your day.